welcome back. For many Black women, the fight for Black lives begins while giving birth. According to the CDC, Black women die from preventable pregnancy complications 3 to 4 times more than non-Hispanic white women. And additional data from the birth organizations shows that among women of color, 33% felt their request for help was ignored or refused. 22% were forced to accept unwanted treatment, and 16% were scolded, yelled at, or threatened. 15% felt that their physical privacy was violated, and 13% felt the medical providers were dismissive of their pain levels. Meanwhile, as the Black maternal health crisis continues, the Biden-Harris administration has recently announced actions to address these disparities. But many women are taking matters into their own hands in an attempt to make birthing safer for Black women. Here to talk about this and much more is Latham Thomas. She's a celebrity doula, she's an author, and she is the founder of Mama Glow, a global maternal health education brand and a nonprofit. Latham, so good to see you back on the show. Talk to me about your Mama Glow Foundation. It's a nonprofit that focuses on reproductive justice through education and advocacy. Say a little bit more about what that means and why it's so important.
Yeah, Mark, thank you so much for having me. The foundation is actually an outgrowth of our work that centers reproductive justice and birth equity at Mama Glow. And at the foundation, we seek to expand resources, educational, create opportunity for birth workers to really expand more access. You share these startling numbers that like we've almost come to like recognize as normal, but it's actually a crisis that we're in, right? And what's really important is that we don't have care providers that look like us. When we think about OBGYNs, there's about 35,000 of them in the United States. And we think about midwives, there's only 14,000. And of that number, 6% are people of color and 2% are Black. So when we think about expanding
Wow.
our lens on what birth looks like, yeah, with expanding the lens on what birth can look like and what you can envision outside of a hospital to have full body sovereignty and autonomy over your body by birthing maybe in a birth center with a midwife or even at home, your choices are really slim. And so through the foundation, we seek to create more educational pathways to make sure that we have more folks of color who are actually doing this work. One of our first initiatives is with Carol's daughter. We have a project called Love Delivered, and it's to empower advocates, everyday people, to take charge of their health, but also to spread this information so that we can be better equipped to ensure that we have better health outcomes when it comes to birth. We have an amazing resource guide on that website, and there's other projects that we're doing, including supporting formerly incarcerated birth workers as well.
We know in general, first of all, just for Black folk, anything that's good, we at the bottom, anything that's bad, we at the top. And when it comes to Black women, that marginalization is even more intense and stratified. We know that Black women's health is not taken as seriously as it should be. We talked earlier about Black maternal death rates. They're at an all-time high. Yet the nation, as you pointed out, has almost normalized it. It's like we just concede that Black women are going to die more at birth. How do we get national attention on this? How do we change, if possible, public consciousness around this issue?
Yeah, I think that this is a critical piece to advancing not only policy but opinion, right? And so when we think about what experiences that we have with the medical system, and we actually call it the medical industrial complex, right? Because we see this as a space whereby it's not designed for our thriving. It's not designed for us to move through with ease, with safety, dignity, and a sense of sovereignty. And it's not a place that is going to fix itself, right? So we have to, as consumers, actively divest in institutions that are seeking to harm us, and institutions that have not set up frameworks for accountability, right? There's only actually two professions where you can get away with harming and actually killing Black people, and that's policing and in medicine, right? There's no accountability set
Wow.
up for
Ooh.
practitioners, right? There's no accountability. So a lot of people can go through, there can be medical negligence, someone can die, and that doctor can go on and practice in another hospital or even in another state and have the same privileges, because this is how we value Black life in this country, right? And so what's happening in terms of the messaging, right, is when we see Black bodies strewn around on social media, when we see lynchings that become normalized, because by the way, we don't see that for white people. We only see this when it comes to Black bodies, right? When we see that, it sends a signal that this can happen to you. So it's a way to sort of remind us that we're not free, right? And the same thing happens when there is information, social media posts, reporting about things that happen inside of the medical system to Black women. What ends up happening is that signals us that this can happen to you. Right. And so there's a fear that people carry that they should not have to carry in the most hopefully joyous moment of their lives. They shouldn't be thinking about whether or not they're going to survive childbirth. And so when we start to come from a space of really being advocates and allies, whether or not you're a mother, whether or not you're in this period in your life, like we all have to stand up and rise up and see this as a human rights issue, not just a Black issue. And we have to put Black birth at the top of the feminist agenda, at the top of the human rights agenda, and really understand that, the movement for Black lives has to start before birth, because we're actually working to fight against forces that are working on us before we even are born.
Absolutely. You are a doula, and some big time celebrities like Alicia Keys and Anne Hathaway, they were your clients. Talk to me about the importance of having a doula and maybe the advantages of home birth as not just a woman, but specifically as a Black woman.
Yeah, so having a doula can be really transformative for the birth process. But primarily, when you think about the pregnancy itself, you have to get comfortable in speaking to your providers, advocating for yourself and your needs and desires, really designing the vision for what your birth process will look like. And doulas can be very helpful in that. So, doulas are non clinical care providers that offer emotional support, physical support, education, advocacy tools, which are critical, and partner support. If you have a partner present, we're there to really make sure that they participate at their level of comfort on this journey and in the birth process as well. And it's kind of like having a producer for your birth, right? Someone who thinks about all the things that are going to make you feel most comfortable as you navigate the process. And so when we think about it from that lens, it's like someone who allows you to really surrender into the process that should, where you can feel your most comfortable, right? And it's a powerful tool, but by the way, it's an ancient tool, right? Doulas have been around since the beginning of time. This is not a new profession. It's the oldest profession, right? Midwifery, birthing, right? And having the support of folks around you. It just wasn't something that was it was just part of the community. It was a community effort, right? An ancestral role. And so now it's evolved to sort of meet the modern needs of a changing society that's moving at a fast pace, where people are spread out and don't have their community supports or their birth villages, right? And so doulas can really help to fill that gap. Now, when we're thinking about this as a Black birthing body, navigating a system, again, that's not designed necessarily to support you best, having people who can help you ask the right questions, who can navigate choices and options that you have, but also talk to you about the importance of consent in medical spaces. We have a really important
Absolutely.
conversation happening, right, about consent everywhere else,
Yeah. No,
but
we
not inside medical
consent,
spaces.
autonomy, control, all this stuff is so key. Latham, thank you so much for joining me tonight, and we appreciate the work you do. We salute you, and we love to have you back regularly to tell us about these key issues in the Black community. Latham, thank you for joining
Thank
me,
you.
everybody. That's it for tonight. I want to thank you for watching Black News Tonight. Up next.